while we are talking about that, I have another follow-up questions to this, okay? Question 3 is, how can completing a clinical documentation improvement course enhance someone's career in healthcare? Like, for instance, I don't want to leave healthcare. I want to leave bedside, but I don't want to leave healthcare because for some of us, healthcare is all we've known all our life. Okay, so we find it difficult to go to, like, for now, there's an adage that say an old woman cannot learn a new dance at old age. Okay, so it's difficult. So how can completing a clinical documentation improvement course enhance someone's career in healthcare, and what advantages does it provide compared to other health-related courses?
All right, thank you for that question. So the thing with clinical documentation is that you are still bringing all of your clinical skills, all of your bedside skills. Those are what you are going to use to be able to ensure that the way the doctor is representing the clinical condition meets the severity that the patient is actually presenting with. For example, for you to be able to know that this a patient where they documented urinary tract infection as maybe sepsis, you need to have managed sepsis on the floor. You need to understand the diagnostic criteria for sepsis. For example, you're seeing that this patient has UTI, then in addition, you can see the white count is elevated. The patient is also tachycardic and tachypneic. Patient has a fever. Then there are other markers of inflammation. For example, the procalcitonin is elevated, lactate is elevated. These are skills that you're bringing from managing patients on the floor. So when you are in CDI, your clinical skills is actually going to be better fine-tuned. So you're not losing any of your skills. In fact, you're putting all of your years of experience, you're putting it into use every day in CDI. So CDI gives you that advantage. And the other thing I say to people is that if you are the kind of person where when you walk on the floor, you always want to document events properly, then CDI is for you, because you're going to enjoy what you're doing. You're going to enjoy reading through doctors and nurses' notes and being able to identify clinical indicators and being able to piece these indicators together and use it to get appropriate diagnosis. Yemi, I don't know if you want to add to what I've just said with regards to the question.
Hello, Yemi, do you want to add something to what? Yeah, you can unmute yourself, please. You're muted.
I keep muting myself. So another good thing, like Dr. Wale mentioned about CDI, is the fact that sometimes when we've worked in bedside for a while, we get fatigued. It could be, stressful, because I've worked in bedside for a long time. I know how it is, how demanding it is. And if you are looking to step away from that stress, and still be in that nursing profession and not leave something that you love passionately, CDI is another way to do it without losing your value, without losing your knowledge, and at the same time benefiting from working from home, from having a balanced family life, which comes from remote jobs.
Wow. This is mind-blowing. I'm beginning to understand that, maybe I could have gone into CDI before, because it will help me in my let's say being able to diagnose, somehow like that, because I think with CDI, it deals more with you looking into charts and reviewing everything that has happened. So every day of my life, if I'm a CDI specialist now, I'm always reading how doctors interpret symptoms and how they treat some conditions. And I think it will make me a better person as a person, though. I don't know if for another person, because I'm reading how Dr. A managed this condition, then I'll read how Dr. B managed the condition, then I'll read. So you guys read all the charts. You're able to go into charts and read them and make your inferences from those charts. Is that what the job is all about?
Yes, and there are criteria.
Sorry about that.
As for each diagnosis that is accepted, its services.
Okay, so there are criteria for each. So you guys have like a guideline or guidepost in all the things.
things to follow, and they kind of help to make the job easy. There are so many things that are that's there to support, new nurses that are coming into the field. Yes.
Wow. Okay. Yemi and Dr. Oluwole, it's like you guys are going to train me in this. I'm beginning to be more interested in this career, honestly. I'm beginning to be more interested in it. Okay, so my number 4 question, and Yemi, if you don't mind jumping in. So with the rise of remote work and work from home opportunities, because after COVID, a lot of people disappeared from the healthcare system. Like, the healthcare in the US is currently short-staffed, not because of any other thing than because a lot of people with COVID, it opened their eyes. You know what? I can do something else. I can't be in the hospital. I don't want the next. Someone told me I don't want the next pandemic to meet me at the bedside because I don't know if I'm going to survive it. That's what the person told me. He said, the next pandemic, nope, I'm not doing it. So I'm out. I want to go and look for what to do. So, but you said this job is actually a job that you do from home. So even if there is COVID, I cannot get it because I work from home. I'm not in direct contact with the patient. So with the rise of remote work and work from home opportunities, can individuals in the clinical documentation improvement field take advantage of this trend? Are there remote job opportunities available for clinical documentation practitioners?
Yeah, there are very many. I mean, lots of remote opportunities. Even before COVID, some clinical documentation specialists were already working from home before the advent of COVID. But there were still a lot more CDSs that worked in office. But with COVID, it made more institutions transition into the remote platform. And they realized that people are even more productive working from home compared to when they were in the office. With the office, there are distractions. Your colleague is there, you chat with them, you smile, you show them pictures. You know how they do here in the US. Mm-hmm. So that's from work. But when you're working from home, there is this thing that says, oh, I need to show that I'm actually working. So you want to meet daily targets and all of that. So that has been proven to demonstrate that it actually increased productivity. And then beyond, with the advent of COVID and remote working, if you noticed, some people that worked in the IT position, some of them have been asked to come back to office. But it's not really like that for CDI. Now, I'm not saying that there are no office jobs for CDI. They are available. They are hybrid positions. There are positions where they require you to come into the office twice a week and stay home 3 days a week, but there are still a lot of remote opportunities, and a lot of those remote opportunities want to stay remote. They are not even looking to go back to the office.
I won't go back to the office if I were them. All right, so now there's another part to this, because the way I'm looking at it is, there's a hospital in Houston. It's called Houston Methodist Hospital. So recently, they introduced virtual nursing. So what they do is, if a patient is about to be discharged from the hospital, instead of having one of the nurses on the floor discharge the patient, they have nurses that are back home working remotely. They will set up a video discharge instruction meeting with the patient. So the nurse from home will be the one talking to the patient, giving the patient all the discharge instructions. And I say this is smart, because with that, you have already relieved a lot of people who may have, who is supposed to, still be standing in front of the patient and giving the patient all those information. So remote job is actually a good way. In fact, if you have not gained that IT skills, like some skills with computer, start doing it now if you have not come to the US yet, because that skill can set you up for you to be a millionaire in life. Because once you're able to get yourself acquainted with how you can work remotely, there's a lot of opportunities that you can tap from. So
Start your journey today by chatting with the Novel Training Services directors on WhatsApp at +1 3463 707111.